At the top of the hour, we told you about an air ambulance emergency, sky-high prices, insurance denials, and customers caught in the middle.
Denver 7 consumer investigator Jacqueline Allen joining us now. Jacqueline, you helped this Colorado family with their bill, but you also kept asking, what is the solution to this problem?
Right, that's what I kept asking everyone I talked to, and there are some good ideas out there. Lauren Adler with the Brookings Institution has been studying this for years. He says there are two problems. First of all, the insurance companies wrongly denying claims.
There's two problems. I think there's sort of two changes. One, I think there needs to be more regulatory oversight of these medical necessity determinations, and right to the extent that this is typically either at the state or federal level, and actually looking over how insurers are making this, with penalizing insurers if they are wrongly denying medically necessary claims.
So you heard him say one solution could be more oversight of insurance companies.
So the other problem you highlighted is just the cost of these things. So very high, and ultimately, of course, that's going to be passed on to all of us.
Well, that's the serious concern and something the No Surprises Act tried to address with medical billing. But consumer advocates tell me in some ways that's backfired.
Almost $100,000 for an air ambulance ride. Is that excessive?
I think yes is the short answer. Unfortunately, what we see with air ambulances are extremely high bills. I think that's something that we are really concerned about in general is sort of the increasing presence of private equity in the healthcare space and how that impacts the costs that are being charged to patients.
Okay, so he and some other advocates say new legislation around arbitration is the answer to try to get these costs back under control.
And Jacqueline, no one ever wants to find themselves in a situation of needing one of these air ambulance rides, but if you do, what can patients do to protect themselves against a surprise bill?
Yeah, no one wants to be in this situation. So I asked the air ambulance provider in our story, Global Medical Response, and she said the biggest thing patients can do is communicate. Don't just hope the bill will go away, but she also said on the solution side that air ambulance providers and insurance companies are starting to work together more often.
Have policies changed because of this?
The biggest shift has been in the relationship and the willingness of Anthem and all of their different counterparts to come to the table with us as a company and really work together to try and keep patients out of the middle of these issues. And they have gone so far as to agree to have one of their medical directors meet with me over cases that are disputed, quarterly. They have become a very good partner for us in working together to try and keep patients out of the middle.
So another possible solution that sounds pretty promising. So hopefully we will not hear more stories like the one we heard tonight.
All right. As always, thanks for your work, Jacqueline. And you can find our extensive coverage and our interviews on our website, denver7.com. Going further in depth here, Colorado has led the charge for medical debt protection and limiting the negative impacts of medical expenses. A law passed in 2023 bans medical debt from showing up on your credit report. Colorado was the first state to enact such a law. And digging into those numbers, the change impacts roughly 700,000 people across the state. Data from the Urban Institute found about 11% of Coloradans have medical debt in collections. It found the average affected credit score rose, though, from 585 to 615 after that law took effect.
There is a tool available in Colorado to try to help you save money on medical expenses. The state launched the Colorado Hospital Price Finder in October. It's a free service that shows the total price each hospital charges for a procedure. You can choose your insurance company and compare. At the time, Governor Jared Polis said Colorado's leading the country in healthcare transparency.
Before our legislature passed the bill to require the transparency, nobody knew this. These were negotiated rates locked in a vault somewhere in the hospital. These were not available to the public. Through our efforts, we've now made them available, and now through this nonprofit tool, free tool, coloradohospitalprices.com, you can actually look it up yourself.
Polis said he hopes the website is the first step to applying pressure to hospitals to reduce their prices.